Only a small portion of the ethmoid bone is visible with an intact skull. From a superior view, you can see the top surface of the ethmoid bone, which is a structure known as the cribriform plate. Extending up from the center of the cribriform plate is the sharp crest called the crista galli. You can also see many small perforations in the cribriform plate known as olfactory foramina for small portions of the olfactory nerves to actually penetrate down into the superior nasal cavity. If you look into the nasal cavity of the skull, you'll see a couple more structures of the ethmoid bone. The first in the center is the perpendicular plate. Just know the perpendicular plate is only a small portion of the wall that divides the right and left nasal cavity, or the nasal septum, so it doesn't extend down as far as it looks like it does. On the lateral side of the nasal cavity, you can also see the middle nasal concha, which is just a fold of bone on the lateral surface of the nasal cavity wall. The sphenoid bone is located posterior relative to the ethmoid bone. You can see that there are two holes, the optic foramen, which extend into the eye cavity. So you can always test this with your pointer and make sure that you're coming out in the orbit. The next structure is a little saddle-shaped structure for the pituitary gland, which is the sella turcica, here seen in side view. Lateral to the sella turcica is a small round hole, foramen rotundum. So it's just lateral and slightly anterior relative to the sella turcica. Next, there are three foramen, and if you learn them in out to inner order, it's a little easier. They are foramen spinosum, foramen ovale, and then foramen lacerum. So if you remember SOL from the lateral to the medial sphenoid bone, those three are pretty easily seen in order. Other than that, the sphenoid bone is divided into the upper top shelf lesser wing and the lateral greater wing.